Coming up in today's video, guys, 2 patients for you. The first one here is a big plug that actually took me, oh my goodness, it took me 3 attempts to get this out. This was an absolute nightmare to get out, really difficult one to do. And the second patient was a lovely chap that came all the way down from Stockport for us to take a look at his ears as well. Yeah, so I'll fill you in about that one a bit later on. And make sure you stay tuned for the end for Comment Corner. Ooh, new feature. New feature. Okay, so our first patient here coming up, this was Joar, a lovely, lovely guy. He came through the clinic. Doesn't like using oil in his ears before we do the wax removal because he finds it's just uncomfortable. The reason for that is because he just leaves it a little bit too long, so his wax goes super dry.
Solid.
It goes absolutely solid, and that's where you can see what's happened here. So when they put the oil in, sometimes it can make you feel more blocked up, sometimes it can cause the wax to expand a little bit.
Yeah.
And what we've got here is this really kind of deep, dry piece of wax here.
Oh, yeah.
And I'm using the forceps now just to break little bits off this. And it's coming away. There you go. Just
It's almost like crumbly, isn't it?
It's gone that, you know, it goes that hard, it goes almost brittle.
Yeah.
That's what's happened here. We've got this really brittle wax, but luckily, this is actually the first, I think this is the first visit. I think there is a ruler shot, and then you see me go back to see the same patient again.
Okay.
And you'll see why, so make sure you stay tuned for it, guys. But getting a grip on these outer pieces here, just these smaller chunks coming away, just try to chip everything I can off this block, because the patient had been feeling, there certainly not so much this side, but the other side was feeling super uncomfortable. He was saying, I'm in a lot of discomfort with this. And when you see the plug on the other side, you'll see why. It's because it is rock solid. But look,
coming away. Wow.
Do you see that peel forward? And then that back part then roll down to the front of the ear canal.
Oh, yeah.
And that is solid. You can tell.
You can see the forceps going to ping off the end of it.
It's like a ricochet. But what you've got there is a really kind of old, dark wax.
Yeah.
You know, it's a good couple of years old. And then we've got this, patient's talking to me there. We've got this really kind of, straight away even the gap. Really kind of deep piece of wax here. So let's get this one. Let's just move this out of the way. It started off, I thought this is just a little bit stuck to the roof of the canal and turned into a peel. So we're just going to peel that down. And the ear canals are really dry. I mentioned to this patient about using oil, sort of prophylactically, using it as a preventer rather than anything else. And I addressed the issue he had with, it hurts when I put the oil in, or it just makes me more deaf. And I was going, look, if your ear canals are clear and we put that in, it doesn't do that to you. It's going to absorb into all this dry skin, this keratin. Look at that peeling away. This keratin in the outer part of the ear canal here, and it's going to absorb into that, keep it nice and soft, and just going to help with that epithelial migration, that movement of skin, which is going to take your debris, your dirt, your dead skin cells, everything out of the canal. It's going to help that to keep working, just as a bit of an aid to the ear, basically. So this is the first visit, okay? So you can see this is one canal. We took out 1.5 inches.
Just under 4 centimetres. Yeah, cheers. I was in the world on my own then. I was watching. I was waiting for the second visit.
So this was the beastie here. Now I literally the first visit, I just touched on it with the right curette, and the patient just almost left the chair. And you can see here we've got that. That little bit of movement there, and the patient was in. It was saying, "Oh no, that's too painful," because I did say he would be in a lot of pain. But we managed to get, and he was really worried, that we were going to have to refer him on to the hospital. And I said, look, we don't fail too often, but look at the size of this plug. You can see now why this was causing so much discomfort.
Yeah.
And this is after 2 weeks, 1 week of oil and a second week of a peroxide-based drop, because the oil just didn't touch it. But look at the chunkiness of that thing. It looks huge.
Causes a lot of pressure as well, doesn't it, with a lot of patients, especially when it's that dry and that hard. When you're a little bit further into the ear canal, sort of roughly where this bit is here, that's just a layer of skin on bone. It's very, very sensitive. So you can imagine almost like a stone kind of dragging against that. It's, if you've ever had this done before, you probably know the feeling, but it can get really uncomfortable when the wax gets very, very hard. So
this is the issue we've got with this patient now, is because the ear canal's been so irritated by this wax that's on top. I've got to be super cautious here with taking this wax away. You've got to kind of just sit just above the ear canal wall skin, and you can see where I'm trying my best to get this as clear as I possibly can. But this patient, he was really, you could see that flinch as soon as I touched it with a right curette there, was flinching. So I'm going to peel as much of this away as I can. It's not going to look super clean at the end, but that's because if the patient could tolerate it, I would have done a little bit more. But the patient just couldn't tolerate it. He was really struggling with it, bless him.
And like I said, that it doesn't happen very often, but I mean, this looks like it has been in there for years. I can imagine it's...
Well, the last wax removal he had was with us, and when I checked back on his record, it was over 4 years ago. Oh. So I did say, look, I want to see you every 12 months.
Yeah.
If you're finding, it's this uncomfortable. You could see a little flinch there as well. If you find it this uncomfortable, and it's causing this much sort of discomfort for you, having it done more often, it sounds counterintuitive because patients don't want to come more often because they're afraid it's going to hurt. But if you come more often, it's not going to be uncomfortable at all. It's just the length of time that wax has been in there for. But eardrum, a patient here, as soon as that big plug came out, he was like, "Oh my goodness!"
You can kind of see it. It almost looks like that plug has been like kind of pressing up against the ear canal down the left hand side. Look, there's a bit of inflammation there.
Redness, all the blood vessels come to the surface there. Yeah. That is one ear canal. That's the full length of the canal. That is average ear canal, 2.5 centimetres, 1 inch. I've done 2 lots of inches.
You've done 2 lots of inches on that one, yeah.
So I've got an inch on either side. So we were talking, that was the full cast of his ear canal. It was huge.
Wow.
Lovely guy came through. This is he's actually follows us on YouTube, he follows us on social media. This chap came all the way from Stockport to get it done because, you know what, this was bizarre. Patient had seen lots of different sort of consultants and GPs who kept taking a look because he kept saying there is something in my ear, and they kept saying no. And so I looked in there. I was like, this is just there's a lot in here. Do you know what I mean? This is a massive chunk in here because he was saying I was experiencing altered sensation. You could feel there was something in there, altered hearing. Some tinnitus. He was constantly having to feel like he had to kind of pop his ears all the time to try and get his hearing better. And this is sitting in there. And it's just a beast to come down. So it's just absolutely huge. So that's
baffled me.
That's bonkers, isn't it? I could understand if it was a small bit.
Oh, yeah.
And you could miss that. Do you know what I mean? I could get... But not this. It's like a boulder.
It's full.
It's huge. So I've put some oil in now just because I'm trying to kind of get this out. And obviously... I really want to get this done because it's a heck of a long way to come from Stockport down to us.
Gosh,
so we want to get this out, and in fairness, it does come away pretty cleanly. In fairness, let's give this a little bit. You can see a little bit of a wiggle. Look at that front right side's moving. That back left is just not budging at all.
I was just going to say, it's looking like it's coming away slowly.
Yeah.
The oil is starting to get underneath it now.
You got it. I just needed almost to sort of unravel slightly. You can see I've moved now to this left-hand side, but it's much stickier on that side. So I've had to unstick that part of the canal. It was really adhered, quite firmly to the canal wall there.
Not much room for it to move around.
It's a bit of an awkward shape because you haven't got any gaps.
Oh, turbo wiggle was out there.
Did you see that then? The guns came out there.
You could barely see the turbos going that fast.
But it needed that bit of kind of wiggling there just to release it from the side of the canal wall. I showed the patient after. I showed him the otoscopy video. Are we looking at these and stuff? I showed him that at the beginning and said, look, this is what was in there. That was what was missed. And when I showed him what actually came out, he was like, he just couldn't believe it. It's just a crazy amount. So there's a bit of staining to the canal walls, one little bit here just at the bottom, so I'm just going to wiggle that off. But the rest of this is just a bit of oil staining. And that's going to come out with the next bath or shower, basically. You can see just trying to get the bits off there. But looking a heck of a lot better in there.
Oh, yeah.
Yeah, so much better.
Oh, wow, look at that.
That is a textbook.
It is a textbook eardrum, that one.
But you can see it looks absolutely fab now. But that was a heck of a piece.
1 centimetre.
I missed it. A quarter of an inch, probably just above that. Was 3/8 of an inch. There we go. Welcome to Comments Corner, new feature we're going to put on, guys. Lots of you ask questions, and I just don't get time to address a lot of them. So what I'm going to do, I'm going to pick a couple of these questions. I'm going to put one on every subscriber video. So this one comes from, I have to really pick people with shorter handles though. Marianne Kaminsky 2152 who asked, are there special tools for paediatric patients? No, is the honest answer, and that's the shortest version. What you'll find, and this is why we've got to be very picky and choosy about the age groups that we can have in for wax removal. Like Taylor can't do pediatrics just because your qualification doesn't allow you to do it, does it? But mine does. So when I see a pediatric patient, when we're booking them in, we do ask, the size, because you do have to use adult tools, which makes it a little bit hard. Sometimes you can, like I have kind of snipped the end off a Rosen inserter before now, just to make it a little bit shorter to try and get pieces out. So and you'll find you'll be using a lot more heavily reliant on things like fine ends, smaller gauge tubing, that kind of stuff. But in answer to your question, there is not special tools, unfortunately, for pediatric patients. So curettage is all the same sizes, isn't it? Very difficult, because if you've got to use a curettage tool, it's very difficult because they're designed for adult ear canals, which is a little bit more space. So this is why it's a more kind of advanced technique when you're dealing with pediatric patients. If you want your comment and your question up on here, just make sure you just pop them into the comment section. Put the questions in, and I'll pick one for every subscriber video. We'll put it on the end, and me and Taylor will voice this one over and talk it through for you as well, guys. Well, guys, thank you very much for watching the video. I hope that answered your question, maybe Ann Kaminsky as well. But as always, guys, take care of yourselves.
Take care of your ears.
And take care of one another. Myself and the lovely Miss Taylor Green. We'll see you for the next video. Bye, everybody.
Bye-bye.